The diet industry has made $72 billion telling you to eat less and move more, and you did, and your belly kept growing anyway. That's not a willpower problem, that's a hormone problem, and they've known the difference for 30 years. Think about the last 5 years. How many diets have you tried? How many times did you cut carbs, skip dessert, push yourself through workouts that left you exhausted? How many mornings did you wake up at a.m., sweating through your sheets, staring at the ceiling, and then drag yourself through another day running on fumes? How much have you spent? Supplements, programs, that treadmill you were sure was going to be different this time. Added up, really added up. Now ask yourself one question: why isn't it working? Because if you're a woman between 45 and 60, the answer has almost nothing to do with what you're eating, and almost everything to do with what's happening inside your body that nobody bothered to explain to you. That is exactly the question Nalia was built to answer. It is a free app that takes everything you just thought about, the patterns, the symptoms, the guesswork, and turns it into a personalized daily plan built around your body specifically. Not a generic diet, not another supplement. A 2-minute daily log that shows you exactly what is driving your hot flashes, your belly fat, and your broken sleep. The link to start your free 7-day trial is in the pinned comment. Go tap it now and come back. It takes less than 2 minutes to set up. The U.S. weight loss industry generates $72 billion a year. Every dollar of that is built on one idea: eat less, move more. That idea works reasonably well for a 28-year-old man. It was never tested on a 52-year-old woman going through menopause. Here's what they don't put in their ads. When estrogen drops, which it does dramatically during perimenopause, your body changes where? It stores fat, not how much, where. Fat that used to distribute evenly now goes straight to your abdomen. This has nothing to do with calories. It was published in Cell Metabolism in 2022. It's not controversial. It's biology. Here's the second thing they don't tell you. Calorie restriction raises cortisol, and elevated cortisol in a perimenopausal woman directly feeds visceral belly fat. You can eat 1,200 calories a day and get fatter in your midsection because the standard diet advice is actively working against your hormones. The diet industry can't profit from that information, so they don't lead with it. In 1994, a team led by Dr. Joanne Manson at Harvard's Brigham and Women's Hospital launched a study that would track 3,300 women through the full menopause transition. They called it the SWAN study, the study of women's health across the nation. Dr. Manson was a cardiovascular epidemiologist. She wasn't trying to sell anything. She was trying to understand why midlife women had completely different health outcomes from the models that existed at the time, models built almost entirely on male data and younger female data. What she and her colleagues documented over the next 2 decades changed everything we know about menopause and metabolism. They found that the weight gain women experienced in their late 40s and early 50s wasn't a failure of discipline. It was a predictable, measurable hormonal shift. They found that the kind of food mattered far more than the quantity of food. They found that stress, sleep, and the timing of nutrition had effects on menopause. Symptoms that no mainstream diet program had ever accounted for. Dr. Manson's data showed that women following certain dietary patterns had measurably better outcomes, reduced hot flash frequency, better sleep, less belly fat accumulation, not because they were starving themselves, but because they were eating for their hormones. That research has been sitting in medical journals for over 20 years. Most women have never heard of it. This isn't new knowledge, it's just buried knowledge. In 1994, the SWAN study launches. 3,300 women enrolled. Researchers begin tracking exactly how menopause changes metabolism, fat distribution, mood, and sleep across different dietary patterns. In 2007, the Journal of Clinical Endocrinology and Metabolism documents the direct link between elevated cortisol and visceral abdominal fat in perimenopausal women. Calorie restriction, the foundation of every major diet program, is confirmed to raise cortisol. In 2012, the Menopause Journal publishes data showing protein timing, specifically getting adequate protein at breakfast, significantly reduces afternoon energy crashes and food cravings in women 45 to 60. In 2019, analysis of SWAN data, published in the Menopause Journal with over 17,000 participants, confirms that dietary fiber is associated with a 19% reduction in hot flash frequency, not a medication, not a supplement, fiber. In 2022, Cell Metabolism publishes findings confirming that estrogen loss, not calorie surplus, drives visceral fat redistribution in midlife women. The mechanism is hormonal. The solution has to account for hormones. 30 years of science. One consistent conclusion: your symptoms aren't your fault and eating less isn't. The answer: so why don't you know this? Because the $72 billion weight loss industry was built before this data existed, and it was never rebuilt to include it. Low-fat messaging dominated the 1980s and 1990 seconds. It was pushed by food companies who profited from low-fat processed products. It was picked up by mainstream diet programs. It became cultural gospel. The problem is that fat, specifically the right kinds of fat, is a precursor to hormone production. For a perimenopausal woman, cutting fat doesn't just fail to help. It can actively lower the raw materials her body needs to manage hormones. This information exists in peer-reviewed journals. It's taught in endocrinology programs. But it never made it into the Weight Watchers plan. It never made it onto the packaging of the meal replacement shake. It never made it into the advice your doctor gave you in a 12-minute appointment. The industry didn't suppress it with a conspiracy. They suppressed it with indifference, because the profitable answer was always, buy our program, not change how you think about protein, fiber, fat, and timing. Let's talk numbers. The average woman going through menopause spends approximately $2,700 a year on weight-related products, programs, supplements, gym memberships, specialty foods. The average menopause transition lasts 7 to 10 years. That's $18,900 to $27,000, spent on approaches built for a 28-year-old's metabolism, while the actual answers, protein with every meal, fiber to reduce hot flashes, fat timing to support hormone production, sleep protocols that reset cortisol, cost nothing to learn and almost nothing to implement. There's a better way, and you're about to see exactly what it is. 3 studies, all peer-reviewed, all about you. Researchers at Cell Metabolism in 2022 examining postmenopausal and perimenopausal women confirmed that the drop in estrogen, not caloric intake, is the primary driver of visceral belly fat redistribution. This means no amount of calorie cutting reverses the underlying mechanism. Hormonal context has to be addressed first. Conclusion: dieting without addressing hormones is treating the symptom, not the cause. The Menopause Journal in 2019, drawing from SWAN data with 17,473 participants, found that women with higher dietary fiber intake reported hot flash frequency that was, on average, 19% lower than women with low fiber intake. This was consistent across age groups, ethnicity, and BMI categories. Conclusion: a simple, trackable nutritional variable directly reduces one of the most disruptive menopause symptoms without medication. The Journal of the Academy of Nutrition and Dietetics in 2021 studied women ages 45 to 60 and found that consuming adequate protein at breakfast, compared to a low-protein or carbohydrate-dominant breakfast, significantly reduced mid-afternoon cortisol spikes, reduced reported cravings, and improved self-reported energy levels by late afternoon. Conclusion: when you eat protein matters as much as whether you eat it. 3 studies, 3 different institutions, 3 different variables, 1 verdict. What you eat when you eat it and how it interacts with your hormones determines your symptoms, not willpower, not calories, strategy. Here's what actually works. No starvation required. This is the PFFT framework: protein, fiber, fat, timing. It's the nutritional backbone of everything the research points to. What you need is a few minutes each morning, a basic food awareness with no calorie counting required, and a tracking system. Step 1 is protein at every meal, starting at breakfast. Aim for at least 25 to 30 grams of protein at your first meal of the day. Eggs, Greek yogurt, cottage cheese, smoked salmon. This blunts the cortisol spike that drives belly fat and keeps your energy stable for hours. Step 2 is fiber, twice a day minimum. Vegetables, legumes, flaxseed, berries. The research is clear. Fiber frequency correlates with reduced hot flash severity. Aim for 5 servings of vegetables daily, spread across meals. Step 3 is don't fear fat. Choose it strategically. Avocado, olive oil, nuts, fatty fish. These are precursors to hormone production. Women in perimenopause who go low-fat often worsen their hormonal baseline. Include fat at lunch and dinner. Step 4 is timing. Avoid caffeine after p.m. It raises cortisol and disrupts the sleep architecture that controls your hunger hormones. Eat your last meal at least 3 hours before bed to support deep sleep and overnight metabolic reset. Step 5 is track your symptoms for 14 days. This is the part most women skip, and it's the most important. Your symptoms tell you what's working. Hot flashes, sleep quality, energy levels, cravings. These are data points, not just complaints. When you track them, patterns emerge. You'll see exactly which foods and habits trigger your worst days and your best ones. That's it. No starvation, no extreme exercise, no supplements required. Just strategy built around how your body actually works right now. Everything I just walked you through, the protein timing, the fiber tracking, the symptom patterns, Nalia maps all of that to your specific data every single day. You log 2 to 3 minutes each morning. The app reads your patterns and hands you a personalized action card that tells you exactly what to do today based on what your body showed yesterday. Women using Nalia report a 60% reduction in hot flashes within 2 weeks. Better sleep, less belly fat, more energy. The link is in the pinned comment. Your 7-day free trial is waiting. Remember Dr. Joanne Manson and the 3,300 women who gave a decade of their lives to the SWAN study? They didn't do that so the data could sit in a journal. They did it because they were watching women suffer through something that was completely manageable, if only the right information reached the right people. The fiber finding, the cortisol belly connection, the protein timing data, none of it is complicated, none of it requires a prescription or a specialist. It requires knowing what to do, tracking whether it's working, and adjusting based on your body's actual response. You've spent years trying to outdiscipline your hormones. You don't have to do that anymore. The science exists. The method exists. The only thing that was missing was a tool that could put it all together for you, specifically based on your symptoms, your patterns, your body. That's what Nalia does. You are not broken. You were just using the wrong map. Now you have the right one. Here's everything waiting for you inside Nalia when you start your free trial today. Daily symptom tracking lets you log hot flashes, sleep, mood, energy, and cravings in under 3 minutes. Your hormone balance score gives you a daily number that shows exactly where you stand and what is improving. Personalized daily action cards are built from your data and updated every single day, not generic tips, your tips. The PFFT meal method gives you done-for-you meal plans built around the exact nutritional timing. The research supports progress insights show you the patterns that are driving your worst days and the habits that create your best ones. 7-day and 30-day mini challenges are short, achievable habit builders that stack into lasting change. 5,000 women are already using Nalia to take their health back. Your free trial is 7 days, no charge, cancel anytime. But here is the truth. Every day you wait is another day of guessing. The data is there. Your body is ready to respond. All you have to do is start. The link is in the pinned comment. Go start your free trial right now.